have a good relationship with your medical team. Establishing who you can talk to just for medical advice, when you need to go for screening and what's the comfort level of your medical team is very, very good to know. Secondly, understand everything you can about the genetic risk. There are very few genetic cases that will result in 100% certainty for cancer. In fact, what a genetic risk simply does is tell you your increased likelihood of getting cancer compared to the normal population. So understanding exactly what that means helps you to navigate and guide what kind of health routines you take on board with you for the rest of your life in your journey. So this popular belief that if you do not have a familial history of cancer, you're at less risk is an absolute myth. And one of the biggest fallacies that we see that often results in people presenting late with cancer. If we use a practical example like breast cancer, where we all know, because it's so well media publicized, that the genetic risk linked to BRCA1 and BRCA2 increases your risk, that only amounts for less than 10% of all breast cases seen. We're very good at teaching our children stay away from ovens and stoves when it's on. We're very good at saying pass the scissors and avoid the sharp point. So we teach our children how to be careful in acute traumatic situations, but we do not teach our children very safe, healthy measures. And it's conversations we can have passing women to women around female reproductive systems. So the most common cancer in women is breast cancer. So teaching your daughter how to do breast self-examination early on in puberty when she starts having changes in her body shape is very, very important. This is a tough one. And with every family and every family member, there's an individual consideration. So the first point of call is have the conversation with the affected member. There's an old age saying that says different strokes for different folks. So some people like those to provide lots of TLC and hovering around, whereas others absolutely do not like the hovering around, and they rather prefer acts of service, for instance, cooking meals on a Wednesday, as opposed to fluffing up pillows, etc., etc. So make sure that you do have the conversation, and it is one that is open and honest with what this patient would like to see in the family. Is firstly medical aid. All cancers from stage 1 are regarded as P&B cases. What does that mean? It means that there has to be a prescribed minimum benefit basket available to that individual, even if that individual is on the lowest plan for that medical aid. So even if you're on a hospital plan, if you are diagnosed with a cancer, there's a basket of benefits available. Then we move on to the cover. Life cover ensures that should something untoward happen to you and you pass on as a result of this disease, you make sure your family is taken care of. Then the second big need would be disability cover. Should I, as a result of my cancer, be unable to work, do I have sufficient cover in place from my employer to make sure that I am covered in case I can't work? And do I need to top that up with individual disability cover? Once you have that in place, then very often people move on to severe illness. So severe illness pays on the diagnosis of a certain level of advanced disease or just on the diagnosis of the disease. So on a typical benefit with Sanlam, we will pay out on the diagnosis, and then the payout amount will be dependent on the level of advancement of the disease.